Hello friends, I am Dr. Harsh Mathur from Om Netralaya, Varanasi, India, and in today's case, we will be discussing what is the importance of multiple chops in NS3 plus grade cataracts, how they are helpful and how they are safe for the endothelium and easily emulsified. So the side ports are being made with this 20 gauge MVR bent at an angle, so it helps a lot while doing phaco in topical. Now the anterior capsule is stained underneath an air bubble, left for at least 10 seconds, and then the chamber is maintained with 1.4% sodium hyaluronate, a triplanar incision barely nicking the limbal vessels. You can see the blood oozing. Now traveling through the cornea, and after getting a sufficient depth to make the tunnel. Now with the bent cystitome, a flap is created, and with this utrata, where I have marked 2.5, 5.5 and 6 mm, it helps guiding the rhexis and making sure that we are getting the desired size of the rhexis. We can measure it again and again while creating the rhexis. So this is at least 5.5 mm. Now hydrodissection, gently tent up the anterior capsule, push some BSS and apply some pressure on the opposite pole, and the nucleus is freed and rotates nicely. Bit of OVD is injected again, and this is cataracts 3 phaco machine. Some superficial cortex is gently removed. The bevel is turned up. You can see that I have kept the tip slightly more exposed as usual, because this is at least NS3 plus. Now this is the karate chopper, blunt at the tip and a nice cutting edge in the inside. We'll be doing a horizontal chop, going in, buzzing in, getting a good hold. Chopper goes to the far periphery, comes towards the probe and then laterally separated. And we have a nice crack. Now we have two heminuclei. So my plan is to get at least 6 pieces. This is the first quadrant. Again, getting a good hold and then cracking. So now I have 3 quadrants. Rotating and trying to bring this, but then this one small quadrant comes up, so I emulsify it. I don't want it moving about in the anterior chamber and causing chattering. So now we have at least 6 small pieces. So now these can be easily brought up and emulsified. So once you are aiming for a 5.5 or less rhexis, it's always better to make multiple chops, small quadrants. They are easier to bring out of the bag and emulsify, and also they are safer to the endothelium. So now I'm staying at the central safe zone. The chopper is doing all the hard part. Now emulsifying the last quadrant, and that's it. In no time, the nucleus is managed. Now the parameters are reduced, and this epinuclear sheet is also managed. So time to come out and go in with my manual. So I have this 360-degree axis with the help of these bimanual IAs. So just by switching hands, I'm able to deal with the remaining cortex. And that's it. A bit of OVD to fill up the bag. And now the IOL is injected. A counter traction with the help of the Sinski. This is a hydrophilic IOL. The leading haptic goes in the bag, and the trailing haptic is then dialed in. Lens is nicely centered. And now wash the OVD. Now thoroughly washing the anterior chamber. Always go behind the IOL and wash. Slightly nudge the IOL forwards, go behind, and with this simple irrigation, the OVD will be washed off. Now removing the remaining OVD. That's it. The case is concluded. A bit of cortex was remaining, which is removed. Now we have a clear bag, IOL nicely centered, a bit of moxifloxacin, and the wounds are hydrated. The chamber is maintained, made. Slight hydration towards the walls. Don't make large blobs of pockets of fluid hydrated cornea. A simple hydration is enough. And now hydrating the roof of the incision, and we are done with the case. I hope you like this video. Do like and subscribe to my YouTube channel. Thanks for watching.